Hi, everyone. Welcome to our Immunize Colorado webinar titled Navigating Federal Changes to Pediatric Vaccine Recommendations. Where do we go from here? This will be presented by Dr. David Higgins, but first I have a few announcements from Immunize Colorado to get us started. A little bit of housekeeping. Webinar attendees, if you have been before, you'll know this. You will be automatically muted for this presentation, but if you have difficulties or any questions, you can put them in the chat box. And then we'll be conducting a Q&A at the end of the presentation, so feel free to pop any questions that you have during the presentation or at the end into the little Q&A box at the bottom of your screen. Please take the time to fill out our post-event evaluation after our webinar. That will help us make sure that the content that we're putting out there is useful to you and kind of on subjects that will benefit you. And then the recording and slides will be available of this presentation on the Immunize Colorado website within 1 week. So if you have colleagues who missed the event or want to refer back to it, it'll be available on our website. Immunize Colorado, we were founded in 1991. We're formerly the Colorado Children's Immunization Coalition, and we are a statewide 501c3 nonprofit that serves to protect Colorado families, schools, and communities from vaccine-preventable diseases. And a few announcements on our end. First, tonight we have a pint night fundraiser at Woods Bros Brewing in Denver from 5 to 8 p.m. $1 from every drink purchase will go back to Immunize Colorado, and it's always just a great opportunity for us to gather with friends and supporters. There are non-alcoholic options, there's some snacks, and it's always a fun time. So if you can join us, we would love to have you. The QR code here is just a link to our Facebook event that has all of the details. So we'd love to see you. And these links, all of them will be put in the chat as well. So if you miss one, don't worry about it. Up next, we have our Colorado Springs Community Baby Shower. This is on Saturday, February 28th from 10 a.m. to 1 p.m. at Hillside Community Center in the Springs. We're recruiting exhibitors, so if you or your organization serves the Colorado Springs area, we would love to hear from you. You can email me if you are interested in joining us. It would also be really helpful for us if you share the event. Again, this is a QR code to the Facebook event. And then we're also collecting donations of lightly used and new clothing, books, toys, strollers, maternity clothing, really anything that would help somebody who is preparing for a new child. So please reach out to us if you'd like to be involved. Next, we have our annual survey. So we love to hear from you all about what you like to see from us. If you take it, you have a chance to win a $25 donation to your favorite Colorado nonprofit. It takes about 10 to 15 minutes to complete. We'd love to hear from you. This is a QR code to the survey. And then 2 other opportunities to work with us. We currently are hosting a motivational interviewing training. We come to you to provide a tailored training on how best to speak to parents, patients, family members, community members about vaccines. It's 2 hours, highly interactive. Like I said, we come to you. We don't need much to schedule it, just 8 people-ish who are interested, and a space that can host a PowerPoint presentation. You can email me if you'd like to schedule one. And then we are still recruiting members for our full-time AmeriCorps Vista program. So if you know of anyone who might be interested in doing some vaccine access activities, please email our Vista leader, Bennett Nye. His email is on the screen and in the chat. Last, times are tough for us. So if anyone feels compelled to donate to our organization, this is a link where you can do so. We always appreciate you being here, sharing our stuff, and of course, donating if you're able. All right, and moving on to our presentation. So today's presentation will be from Dr. David Higgins. He is a Colorado pediatrician and public health physician whose work focuses on improving child and adolescent health through practical, evidence-based approaches to vaccine delivery, communication, and confidence. He has practiced primary care pediatrics in both Colorado and Montana, caring for children and families in urban and rural communities. Those experiences continue to shape his research, advocacy, and commitment to strengthening trust in vaccines and public health. Dr. Higgins is an experienced writer and speaker whose work and commentary appear regularly in national media. He publishes the Community Immunity newsletter on Substack and frequently contributes to Unbiased Science. He serves as the vice president of the Colorado chapter of the American Academy of Pediatrics and sits on the board of directors of Immunize Colorado. So without further ado, I will hand things over to Dr. Higgins. Thanks for being here.
Well, thank you so much, Sarah. Let me get my slides pull up here and make sure I'm sharing this correctly. All right. You should all be able to see this. So thank you so much for hosting this. This is such an incredibly confusing time. And I am seeing confusion not only from the parents and patients that I care for, but other community members as well as clinicians. And multiple different types of providers that have a role in delivering vaccines. So I'm glad we can have this conversation today. I hope after this that you are both take away some practical tips to how to navigate this moment and feel like you have some sense of where we're going. To start, I have no relevant financial relationships with manufacturers or any commercial products or providers of commercial services discussed today. I do not intend to discuss any unapproved or investigative use of any products. And like Sarah said, I am a volunteer on as the vice president for the American Academy of Pediatrics Colorado chapter, as well as Immunize Colorado. I'm also on the steering committee for the Evidence Collective and a contributor to Unbiased Science, both of which will be mentioned in this talk. Okay, so here's what I'm going to share with you. We're going to spend the first 15 to 20 minutes kind of just setting the stage. I want to talk to you about what has changed. And then we're going to go into, okay, how do we communicate this to patients, to families, to our community members? Finally, I want to give you some practical guidance and resources that you can use no matter what your role is in vaccination delivery. And we're going to end with questions and answers. And that question mark at the end of answers is there on purpose. I'm not sure I'll be able to give you answers to all your questions, but I want to help us navigate this together. Okay, so to start, setting the stage. Let's just review real quickly what happened from April to December of 2025. First, as many of you know, legitimate ACIP members were fired and replaced with mostly unqualified individuals, several of whom are vocal vaccine opponents. Liaison organizations. These are organizations that in some way contribute to vaccine delivery, were dismissed from work groups for the ACIP. And let me back up and say the ACIP is the Advisory Committee on Immunization Practices. It is the independent committee that advises the CDC on its vaccine recommendations. And behind the scenes, there are work groups that really do, as they say, they get the work done to review the evidence and to make recommendations to the formal committee. The liaison organizations were dismissed from that. And really, there's been wide criticism of the meetings that have happened in June, September, and December of last year as being platforms for misleading claims. And there have been dozens and dozens of misleading claims that have really come out of these meetings. The American Academy of Pediatrics has continued to reinforce the critical role of the original ACIP. And the ACIP's purpose is to bring together these independent groups, organizations, and experts that have a part in child health care delivery across the spectrum of different institutions and disciplines, bring them together in a place where they can make better guidance about vaccines. The American Academy of Pediatrics recently published recommendations in a separate schedule. They not only published these last year, but there's the 2026 recommendations that here in just a minute I'm going to go through in more detail with you. So that's what happened in 2025. And in 2026, even though we are only officially a month in, a lot has happened. So on January 5th of 2026, just for about 4 weeks ago, the politically appointed leadership of HHS announced overnight changes to the childhood vaccination schedule. Several vaccines were moved to shared clinical decision-making or high-risk categories, and they created really this tiered recommendation guidance. Notably, the HPV vaccine, which prevents multiple different cancers, including cervical cancers and cancers of the mouth and throat, among others, was moved to a single dose at age 11. And the reasoning given behind this change was to restore trust in vaccines. So there were several concerns with this process. One was that this did not follow the processes that we have in place to ensure vaccine guidance is not only rooted in evidence, but it can be implemented well to optimize the health and well-being of kids in our country. That is the purpose of the processes that we have in place, where we bring in independent experts, where we listen to and hear from the public and what their concerns are, where there's rigorous review of the evidence to make sure we are giving the best recommendations possible. Well, these recommendations were made to align with peer nations. And Denmark is notable in that the recommendations are most closely aligned with Denmark. The problem with this is that Denmark itself is an outlier. Denmark was really chosen, it seems, to make the US schedule look, quote, bloated compared to peer nations, when in reality, the US vaccine schedule is similar to countries such as Canada, Germany, Italy, Australia, among others, and that fact was ignored. And the bottom line is vaccine schedules aren't interchangeable lists. You can't copy and paste one country's vaccine schedule to our country and expect the same outcomes. Different countries have different populations, health systems, size, cost considerations, and resource considerations. And all of these play a role in making vaccine guidance at the national level. This guidance was made without any disease burden modeling. That's a scientific fancy word for saying, let's at least try to anticipate the harm that could be done with these new recommendations. That wasn't done. There was no impact assessment. How is this going to impact not only the end outcome, and the end outcome being preventing disease, but also how is this going to impact things like supplying vaccines? How is this going to impact vaccine recommendations and delivering vaccines? There was no public input. There was no public comment period. And really, they bypassed the independent expert review that we normally do. There really wasn't transparency in the decision-making process. There was, after the decision was made, there were some justifications given, but there was no transparency during the process. And remember, what really matters is health outcomes, not the number of vaccines. Okay, what matters is how many illnesses, how much disability, hospitalizations, and deaths are we preventing with vaccines? And we need to remember that those are not the only outcomes we all care about. We also care about things like financial costs, missed work in schools, cost of families and communities when they have to deal with these vaccine preventable diseases. And finally, I have a personal frustration that there really wasn't an acknowledgement that, okay, if the US was ahead of some other countries, that in itself is not necessarily a bad thing. In fact, why are we not seeing that as the US being a global leader in vaccines, which it has been for decades? I said this recently in something that I wrote. I said the US was an outlier, if you want to put it that way, because it was a leader in preventing childhood disease. That should be something that is celebrated, not something that we need to change. So several of the routinely recommended vaccines were changed to shared clinical decision-making. I want to be really clear about this. Already, prior to this change, clinicians make shared decisions with families every single day. Shared clinical decision-making has a specific meaning to those of us in medicine. It does not mean involving parents in decisions. That is something that we already do all the time for all decisions. Parents are always the ultimate decision maker, and we respect that autonomy, including for vaccines. In medical practice, shared clinical decision-making is usually a style of communicating and making a decision that we use when the evidence is really unclear about what's best to keep a child healthy and thriving. And it's used in cases where, hey, there are multiple options that exist, and there's not clear evidence that one of these paths is better than another. In reality, shared clinical decision making implies clinical uncertainty, not simply patient involvement. So I want to be clear. We have always involved families. We will continue to involve families. And we do that every single day. And vaccines are something where vaccines are a decision where there is one course of action that has a lot of evidence that it's better at keeping children healthy. Here's the rhetorical twist that's being used right now. On the surface, shared clinical decision making sounds empowering, right? But again, it implies uncertainty exists despite strong evidence. When you imply more uncertainty exists than there really does, that undermines clarity. It really signals like, okay, this is really optional importance, right? I mean, if you choose not to, it's really no different than choosing to vaccinate. And it creates real practical issues for providers and clinics and health systems, documentation, reminders, workflows, things like this. And we do know that this type of label from federal guidance leads to lower vaccination coverage. It is also confusing, incredibly confusing for parents to have tiered recommendations. I mean, I don't blame a parent when they see a tiered recommendation and think, oh, well, these vaccines, they must not be as good. They must not be as beneficial to my child because they have a different recommendation when that is not the case. There's also concern about lawsuits and legal problems for manufacturers with vaccines under the shared clinical decision-making guidance label. Okay, let's shift here. That's what's happened from the Federal Health Administration. Now let's shift into the American Academy of Pediatrics and their recently released immunization schedule. The 2026 AAP recommendations remain largely unchanged from prior guidance. And if you didn't know this, for decades, the AAP has partnered with the CDC to create a unified set of vaccine recommendations. Okay, this is something they've worked together to harmonize for decades. But this year, changes to the CDC schedule are significantly different than the American Academy of Pediatrics schedule. And the AAP schedule has been endorsed by all of the major medical organizations that care for the health of children. This is really important. Family physicians from the American Academy of Family Physicians, the American College of Obstetricians and Gynecologists, the American Medical Association, among all of these other partners, have stood up together and represent over 1 million health providers that have some role in the health of children. They have said the American Academy of Pediatrics is the schedule we endorse. Why? Because it's based on the evidence and it is the best schedule for keeping kids healthy and thriving. Let's just look at a couple of the vaccine preventable diseases that the American Academy of Pediatrics schedule routinely recommends that have changed in the federal vaccine recommendations that either have been made high-risk recommendations or shared clinical decision-making. So first is RSV. And depending on where you're watching this in the country right now, you may be in the thick of RSV season. It might be just kind of ramping up. Here in Colorado, we have started to see more and more RSV in the past several weeks. And every pediatrician knows all about RSV. We swim in it every winter. Kids can get incredibly sick from RSV. Even previously healthy infants can develop RSV, need oxygen, need hospitalization. Parents take a significant time off of work, and RSV can be a real burden for families, even healthy kids. In fact, it's the leading cause of hospitalization for infants. Fortunately, we have seen immunizations for pregnant mothers and antibodies that we give just after birth. Both of these have only become available in the past several years. We're already seeing dramatic improvement in hospitalizations, down by over 80%. That's incredible. And what we saw in the federal recommendations is that they moved this into the high-risk category. Confusingly, the recommendation didn't actually change. because every single baby that's born is considered high risk if the mother did not receive an immunization at the proper time in pregnancy. So while the recommendation didn't change, this sure confuses everyone. Influenza. So the American Academy of Pediatrics recommends influenza for all children starting at 6 months old. This not only protects the child, but also the community. And historically, we know that an overwhelming majority of influenza-associated pediatric deaths, of which we've already had too many this season, occur in unvaccinated or incompletely vaccinated children. And we know that younger children are particularly vulnerable, those under the age of 5 and especially those under the age of 2. Last year was one of the worst influenza seasons in over 15 years, with 280 pediatric deaths. And so far, this current season is starting quite severe. We won't actually know more about how bad this season was until long after the season's over. Let's talk about hepatitis A real quick. So this is a vaccine that we recommend for all children starting at their first birthday. And prior to widespread vaccination, hepatitis A was common and would spread through communities. And because of vaccination and because of the community immunity developed with vaccination, circulation now in the US is much more rare. However, hepatitis A vaccine is simply holding it at bay. If vaccination rates were to drop, we would once again see this disease come back. Let's talk about hepatitis B. So hepatitis B is recommended for all infants with the first dose happening within 24 hours after birth. It is an incredibly transmissible disease, and it unfortunately can cause liver cancer, cirrhosis, which is liver damage, and death. Prior to widespread vaccination, tens of thousands of cases a year of hepatitis B in children occurred. And infants are particularly vulnerable. In part, at birth, they can be, we call it perinatally infected at birth if the mom has hepatitis B. And unfortunately, our screening for hepatitis B and our health service delivery for during pregnancy to catch these cases of maternal hepatitis B is not great. Infants and children also, when they're exposed to hepatitis B, they are much more likely to develop severe disease. And this is really important to understand. Infants and children can get hepatitis B after birth when they are young children. This can happen from casual contact with household members and exposure to things like blood that contains the virus. So this not only protects children at birth, it also protects them when they are young children, at a time when they're most vulnerable. Let's talk about rotavirus. So rotavirus vaccine is recommended for all infants starting at 2 months of age. And the rotavirus is a horrible diarrheal and vomiting disease. It causes severe dehydration. Prior to widespread vaccination, there were about 50,000 hospitalizations per year from rotavirus. And in countries where they have not introduced the rotavirus vaccine, in the middle of winter, you will see pediatric hospital wards filled with kids who get rotavirus and they cannot stay hydrated. So they're there and they're severely dehydrated and need IV hydration to maintain their hydration. Since routine vaccination here in the US, we actually rarely see this now. And many of us have only taken care of a handful of these patients because we have high levels of protection from the vaccine. Okay, I'm going to cover two more real quick. The meningitis vaccines or meningococcal vaccines. So these vaccines we give both at 11 to 12 years when kids enter kind of that middle school age, and at 16 years. And this is kind of prior to a lot of kids and adolescents going on to college. This is a severe disease with incredibly high morbidity and mortality. Now, the ACIP was actually already considering changing recommendations prior to what occurred this past year. And that's for several different reasons, in part because there are new vaccines that protect against more strains of meningococcal disease all in one vaccine. And so some of those changes were already in the works. The AAP schedule continues similar recommendations to last year. And then let's talk about the HPV vaccine. We recommend this for all children starting as a 2-dose series at the age of 9 to 12, or at a 3-dose series if they started later. Now, the ACIP and the American Academy of Pediatrics had already been reviewing data about whether this recommendation should change. But prior to dismissing the ACIP members and really changing these work groups, that work hadn't been completed. There are several issues that really need to be evaluated before there can be a new recommendation, and they were right in the middle of doing that really important work. That, unfortunately, has been put on pause. There are other groups like the Vaccine Integrity Project who's currently undertaking a review of the HPV vaccine evidence, and it really is something that we need to continue to move forward, but the chaos at the federal level has made that challenging. It's also unclear what the schedule change means for our implementing our current recommendations from the American Academy of Pediatrics and what pediatricians feel is best, and that is starting vaccination at age 9 to 10. Okay, I'm going to just pause for a second. So that was an overview. I just told you an overview of kind of what happened at the federal level, that the American Academy of Pediatrics and the House of Medicine supports the American Academy of Pediatrics schedule, which is the best, most evidence-based way to keep kids healthy and thriving. Now comes the hard part. How do we communicate all of that to patients and families? I just spent 20 minutes communicating all of that. You don't have that time. And the way I just communicated is at a level of understanding of vaccine policy and vaccine preventable diseases that a lot of families and your communities aren't going to understand. So how do we do this well? Well, first, I think it's really important to recognize what families and our communities need right now. This is what they're asking us. I have heard these exact statements myself. This is what colleagues are telling me. They're hearing from their patients and parents. They're asking things like, what is recommended now? Why are there different recommendations? And I'm just confused. And we are hearing this from parents who have accepted vaccines, who have really never had a lot of questions or concerns. But understandably, they're confused right now. What they want from you is they want their child's health provider. Whatever your role is in providing health, that's what they want right now. They're reading headlines. They're seeing things on social media. They're hearing things through their neighbors. They want someone who they can trust, who also has the expertise to provide them reliable, credible recommendations. They are looking to you for that because they're not able to get that anywhere else. Let's be really clear about what has not changed. Look, most families continue to vaccinate. Yes, we are seeing gaps in vaccination coverage that are incredibly concerning. We are seeing the federal chaos leading to erosion of trust in vaccines, and that is a huge problem for the health of children. And yet, at the same time, most families are choosing to vaccinate, and that remains to be true. Another thing that hasn't changed is that vaccines remain one of the most effective ways to keep children healthy and thriving. Also, a recommendation still matters. I know that a lot of you who talk to families, who give recommendations, who do this work of communicating with their communities and with parents are feeling tired right now. I know that you are feeling overwhelmed by not only answering common concerns and questions that we have answered and helped parents navigate for decades, but also the fact that our federal government is saying something very different. And that is confusing for parents. But I want you to remember that a recommendation still matters. I also want you to remember that, look, counseling, answering questions, and allowing space for questions and shared decisions, that's always been a part of vaccine care. Nothing's changed with that. So here are a couple of things that you can do when you have these conversations. First, I recommend starting the same way that you always have. Announce what a child's due for. Let them know what they're due for. And make sure that you know that they know what you recommend. Example language for this might be saying something like, today your child's due for the DTaP, polio, and pneumococcal vaccines. I strongly recommend these vaccines to keep them protected. You do not need to preemptively explain controversy. You don't need to jump into a conversation about federal vaccine guidance and why it differs from guidance from other organizations. A lot of families do not actually have those concerns, and preemptively explaining controversy will potentially undermine their confidence when they were really just looking to you for a recommendation and to help them walk through this. And I want to be really clear that a strong recommendation that vaccinating is the best way to keep their children healthy and thriving, that's compatible with shared clinical decision making. Let's talk about shared clinical decision making a little bit more in your role. Again, you have always respected parent autonomy. Keep doing that. Ultimately, parents have the choice. You've always left room for questions and discussed the risks and benefits and given those risks and benefits to parents. Nothing's going to change about that. You can both respect autonomy of the parent and you can recommend vaccines. And shared clinical decision making does not require neutrality. Okay, this does not mean that you cannot have give the family your recommendation on what the best thing is for their child. You have a responsibility as their healthcare provider, as their child's pediatrician, to share with them the evidence on what's going to keep them healthy. And understandably, parents are going to have questions. Look, parents are not listening to these webinars. They're not spending hours a week trying to figure out what's going on. They're seeing headlines, maybe reading a whole article. They're seeing social media posts while they're flipping through social media, even if they don't go looking for it. And what they hear is conflicting messages. So I really want you to lead with empathy that this is a confusing time for parents. And it's understandable that they're going to have concerns and questions. When you place yourself in their shoes and remember that that's their experience right now, it makes it a lot easier to lead with empathy and say something like, hey, I can see why this feels confusing. There's a lot of conflicting messages out there. Ultimately, this is your decision to make. And would it be okay if I shared with you why I recommend these vaccines on the AAP schedule for your child? Now, when parents do ask questions, it's important that you share information with them in digestible, credible ways. So this includes, first, asking open-ended questions to really understand the parent's concerns. And when you really feel like you understand what they're concerned about, answer in a way that stays focused on their concerns and include short, digestible explanations. You do not need to go through a whole presentation of the vaccine schedule, okay? You do not need to spend 30 minutes talking about all these different things. It's important to identify what the parent's specific questions and concerns are. Example language for this might sound something like, this vaccine works best when we give it now before kids are exposed. That's why I recommend it to all my patients. That's why I gave it to my own kids. And that's why the AAP still recommends it. This is shared clinical decision making, listening to specific concerns and questions and responding to those. Okay, I'm going to just hit this point one more time. Only address changes if parents bring them up. Okay, if they don't ask, you don't need to introduce new concerns. I unfortunately did this myself. I started telling a parent all about the history of the American Academy of Pediatrics recommendations and vaccine schedule changes and all of these types of things when they simply asked what I recommend. And after a couple of minutes of explaining all of this, the parent said, hey, thanks, that was really, interesting to hear, but I honestly just wanted to know what you recommend because I trust you. That's it. I accidentally went into way too much. So be careful with that. And look, if a parent does ask, I really try to recenter on the child's health. That is your role, right? Not the policy changes. You're not having a conversation with the policymaker. You are having a conversation with a parent. And for both you and the parents, the child's health is the most important thing. Reaffirm your recommendation, and again, stay focused on what the parent's specific concerns are. So example language for this might be something like, it sounds like you have heard about some recent changes and have questions. I'd love to hear about your specific concerns so we can talk about what's best for your child. And don't forget that families still trust you. Okay, so while we have absolutely seen decreasing levels of trust in institutions and in many different areas of life right now, consistently, parents are still saying that pediatricians and clinicians, their child's health provider, is the most trusted source of vaccine information. And look, trust is ultimately relational, not institutional. Your face in front of them, your voice carries so much weight and credibility. That human connection really matters. That is why trust still lives in the exam room. And remember, a strong recommendation matters and staying consistent. Your voice still matters more than headlines. So here is a simple mental checklist for you. First, before you start any conversation, or if you recognize you're about to go into a conversation about vaccines, whether you're in the exam room or whether you're at a barbecue, I want you to internally name the emotion that you're feeling, okay? I want you to make sure that you're recognizing maybe you're upset, maybe you're frustrated by what's going on. Maybe you are appropriately angry about things that you see as worsening the health of our children, okay? I want you to recognize that and recognize who you're talking to. You're talking to a parent who is confused, a community member who is confused, and understandably doesn't know what's going on or who to believe. Name that first in yourself before you start these conversations, because it makes it much, much easier to have empathy. And then announce what's due if that's the role you're in, right? If that's the role you're in, announce what's due and make a strong recommendation. When concerns arise, really empathize with that parent and partner with them to walk them through the decision making. Answer what the parent asks and what their concerns are clearly and simply. You can anchor to guidance from the American Academy of Pediatrics. You can trust that guidance. And ultimately, always recenter on what's best for the child's health. Again, remember, families need a trusted navigator right now. They are lost at sea with social media, with headlines, with conflicting guidance. They need a trusted navigator. And that's all of you listening in today. They need someone who knows their family and their child and the community that they live in, the context that they are doing life in. That's really important. That can't be replaced online. That can't be replaced from institutions. And they do want expert clinical recommendations from you and clear guidance. They trust you because you have walked through many hard decisions with them over the years. And remember that communicating effectively about these things is not just something that needs to happen in the exam room. Outside of the exam room, if you're a clinician or if you're not a clinician and you're listening to this talk, you can do these things that are really important. First, reinforce consistency. Align messaging across settings. And settings include healthcare, but also include schools and religious settings and community centers and libraries. Consistent messaging is going to help. Reduce confusion. Don't spread speculative interpretations of federal changes, right? Make sure that you really understand what is going on before you spread things. Third, anchor to evidence and local context. Emphasize the disease risk and impact on your community. Okay, you know your community, so emphasize the things that are important to your community and your community's values. Also, make sure to emphasize what has not changed. Finally, you can really help support us clinicians, right? Make the exam room conversations easier by supporting good, reliable messaging that parents are receiving prior to the exam room. And remember, trust is built locally. And you have such an important role in that. No matter what your professional role is, you have such an important role in building trust in our communities. Okay, so I'm going to shift now to the final section. And here I want to both explain a little bit about why, what has happened and what has broke, and then some practical guidance and resources. This is really, okay, how do we navigate this together and move forward? So first, I want to make it clear, this is the problem that we're dealing with outside of the exam room. This is kind of this is the timeline, if you will, the process from the research into vaccines all the way through people getting vaccines and being protected from disease. And there are many steps in this, many steps that involve both the incredible scientists that have discovered these vaccines, to the manufacturers that make them, to the people that recommend them, to the health clinics and pharmacists and others who deliver vaccines. Now, all of these things in the US point to federal guidance. Okay. And so when federal guidance is disrupted, when it is thrown into chaos and unclear, everything falls apart. And this has important consequences. So this is a slide from the Common Health Coalition, who has incredible resources, and I'm going to share more of their resources with you in a minute. They have just incredible explainers to help make sense of this moment. And this is an explainer I really like because this shows some of the impacts that you all might not be aware of in some of the other sectors that you don't work in every day. So when the childhood immunization schedule changes at the federal level, we just talked a little bit about how that affects the public and patients and health systems, right? But also this is going to affect things like vaccine manufacturers. We have already had a vaccine manufacturer come out and say, hey, we're not sure we're going to invest in some of these late stage clinical trials for new vaccines because we're not sure that there's enough stability in the US. That's a problem. That will lead to fewer vaccines being available, right? At the level of public health departments, you are seeing all sorts of confusion and problems with, okay, how do we implement these changes? How do we implement these changes in the vaccine infrastructure that we help deliver? I'm not going to go through all of this slide out of the sake of time, and I will link to these resources, but incredibly valuable resources that show not only the short-term impacts, but also what are the long-term impacts. And I will say the long-term impacts for these changes is worse health outcomes, increased strain on our health systems, less vaccination, and less access and choice to vaccines for people. One of the other great resources that they have that I just wanted to share quickly is this, what can you do? And I like this because it talks about what you can do if you're not a clinician, if you have a different role, if you are a state leader, if you are in public health or in health systems. There are many different ways that you can protect vaccine access for your patients and community members and protect vaccine confidence. State leaders, for example, can back evidence-based schedules like the American Academy of Pediatrics schedule that I already shared. Payer organizations can commit to making sure cost is not a barrier to getting vaccinated. That when a family says, I really do want this vaccine for my child to keep them healthy, that cost is not coming in the way. So all of these resources and more are available through the Common Health Coalition, and I've got a QR code here too. You can Google it as well, or type it into your search bar. There are incredible resources and FAQs. There's a great shared clinical decision-making guide available and different explainers. I really encourage you to look into these more. Of course, I'm going to mention great resources from the American Academy of Pediatrics, in addition to their vaccine schedule, where you can find more about the specific vaccine recommendations. There is the AAP Red Book, and for those of you who aren't, maybe clinicians in child health and don't know what this is kind of the ultimate guide to pediatric infectious diseases, and they have even more great detail and background on these vaccine preventable diseases. And healthychildren.org is an excellent resource that I send most of my parents and patients to and families because it breaks these complicated things down in really digestible ways. I do want to mention that recently there was publicly announced that CIDRAP at the University of Minnesota and the Vaccine Integrity Project have teamed up with the Evidence Collective and Unbiased Science, and they are putting out great resources. The Evidence Collective and Unbiased Science are independent groups that are, really experts in science and health communication. And together, they are sharing incredible resources that help, again, really explain to the public, explain to policymakers, explain to leaders why vaccines matter, help them make sense of some of the nuance and detailed conversation around vaccines and vaccine preventable diseases in this moment. And then, of course, I'm going to say there's great resources with Immunize Colorado as well. And Immunize Colorado is a great example of local contextualized resources for Colorado. So while some of these national resources are helpful, it really matters when it's people in your community that understand Colorado and how we are similar, but how we're also different than a lot of other parts of the country. And Immunize Colorado has so many resources available there. I also want to mention Colorado Chooses Vaccines. This is a new organization that brings together a group of healthcare providers, public health leaders, and community groups committed to protecting vaccine access and public trust across Colorado. This also includes Immunize Colorado in this group as well. And this really is just an effort to make sure that Coloradans continue to have access to vaccines, continue to be able to choose vaccines, to keep their children, their families, and themselves healthy and thriving. And then here in Colorado, and in your own part of the country, hopefully you have great resources. But here in Colorado, we have an incredible immunization branch at our public health department that's putting out great resources. And one of the important things that Colorado has done is reaffirmed that families should follow the American Academy of Pediatrics immunization schedule. And this comes on the heels of two laws that we passed last session. One that incorporates the AAP schedule into school and childcare immunization requirements, and has taken steps to make sure that financial barriers are not a problem for receiving vaccines, at least with state regulated insurance plans. So Colorado really is leading the way in this, but they're not alone. So this is a recent figure from Kaiser Family Foundation showing that most states are departing in some way from federal guidelines for childhood vaccines. Most states are saying, nope, you know what? We're going to follow what keeps our children and communities the healthiest. And as a result, a lot of states have departed from the federal guidance. Okay, so that's it. I want to wrap up so I leave time for questions. I want to just acknowledge a couple of people. Dr. Sean O'Leary, who is the chair of the Committee on Infectious Diseases for the American Academy of Pediatrics, and really has not only helped lead the immunization recommendations, but has been a national leader and really a lighthouse for all of us during this time. And then the Common Health Coalition and some of the leaders and individuals there that have just been putting out incredible resources for all of us trying to navigate this. And then, of course, acknowledge Immunize Colorado for hosting this webinar and being a great organization in Colorado that has a long history of doing incredible work around vaccines and ensuring that Coloradans have access to vaccines and good information, reliable information about vaccines. So that's it. I want to thank you for listening in to this webinar today. You can find me on the socials at Dr. Higgins, MD, and also my free community immunity Substack is where I share a lot of this information in more of a written form, and I would love to see you engage there. So we're going to move into question and answer time, and I'm going to stop sharing. Perfect. There we go.
Great. Thanks so much for breaking down this incredibly complex and confusing time in the world of immunizations. Really appreciate it. We do have a few questions. So first, Have you noticed any recent or changing themes or trends in provider rationale for not consistently recommending immunizations? This person is wondering how best to increase their physician or provider immunizate or recommendation rates.
Yeah, so I think it's really important that clinicians and providers also understand the evidence, the reasons why the American Academy of Pediatrics schedule and their recommendations are evidence-based and better for protecting the health of children in our communities. So I do think it's important that they're also up to speed on why these recommendations are better. And I am also concerned that some providers and clinicians are, interpreting the new guidance as, oh, maybe I can't give a recommendation, when that's not the case. You absolutely can still and should still be recommending what is best for your patient's health. That's just a truism that has always been there and will continue to be there. Recommend what's best for your patient's health.
Great. We love a simple, concise answer. Couple other questions. So one person is asking to identify the organizations and stakeholders in Colorado who are working to combat the organized anti-vaccine forces, particularly around undermining school vaccination requirements in the state.
Mm-hmm. So it's a good question, and I'm not going to necessarily just list everyone who's been involved in this. But what I will say is there is a strong community in Colorado of different organizations and groups that are committed to making sure there are common sense requirements for vaccines to protect our schools and communities, and to make sure that parents and patients continue to have access in and confidence to vaccines. And that includes Immunize Colorado. That includes our public health departments, both at the state level and our local public health departments. That includes all sorts of champions like school nurses, pharmacists. That includes other our community of medicine in Colorado. Groups like the Colorado chapter of the American Academy of Pediatrics, but also groups like the Colorado Family Physicians and others who help take care of kids. It's a very large tent of people who are committed to addressing misleading claims, to addressing things that actually misinform our parents, patients, and communities. There's a large group of people that are committed to that.
Yeah, and I'll add on to that just a shameless plug for our Immunize Colorado Policy Committee. If you are interested in getting involved with our policy and advocacy efforts, we're very welcoming and would love to have you. So please reach out to one of us if you want more information on that. Next, can you share with us what you know, if anything, about if and how these changes are impacting insurance coverage, specifically for the vaccines that were removed from that universal recommendation?
Yeah, it's a great question. As of right now, as of today, we're not seeing impacts to insurance coverage. You should still be able to get these vaccines for your children and not have to pay. Okay. And that's true whether you have a public insurance like Medicaid or whether you have private insurance. Now, I am concerned that maybe what will happen over time is vaccines that seem to have a differential recommendation may not continue to be covered over time. And so while I'm reassured today that that's the case, I don't want us to ignore and keep and not look down the road. And that's why consistent, credible recommendations are so important.
Yeah, definitely a concerning thing that could happen in the future. And yeah, scary unknown.
Mm-hmm.
How do you approach parents who are using anti-vaccine, anti-science resources as their source of information about vaccines?
Yeah, that's a great question. So first, I want you to, when I approach this conversation with parents, like I said, step one, I first acknowledge in my own head, I say, hey, this parent is not the anti-vaccine group spreading information. They are being influenced by this, but that's not them. That helps you have a lot of empathy for them, right? They are being fed these misleading claims into their social media feed, into their anxious heads, right? I mean, I'm a parent too, and being a parent involves a lot of anxiety about the health of your child. And they are victims of those misleading claims. So start there. Find out what their specific concerns are. Okay? Really ask good open-ended questions to find out what exactly are they worried about. And then remember that most parents, even ones who come in and they might be hesitant to vaccinate, most parents have some sort of ambivalence about this. They see the claims coming from anti-vaccine groups, and at the same time, they think, well, I don't want my child to get measles. I don't want my child to get cancer, right? And so there's a discrepancy there that's important to explore with the families. It's also really important that your conversation not become a debate, that it not become an attempt to convince them why they are wrong and why the anti-vaccine people are wrong. Because while that's often the first thing that we try to jump to, we know that that doesn't work. What that frequently does is actually causes them to dig their heels in more. When you frame the entire conversation as a partnership, trying to help them understand and navigate these questions and concerns, and recognizing that an overwhelming majority of these parents really are unsure. They have seen the misleading claims, but they're really unsure. It makes for a much, much more productive conversation.
Great, thank you. And yeah, I'm glad that question was asked because I think that's something all of us can always be working on, is just how to best address this with parents and patients and community members and everyone.
And I'm going to put another plug in, Sarah, for the motivational interviewing courses that you have done. I have had the privilege of being a part of those that you've done. And they're great because they help teach you really practical skills that any of you can learn to communicate better. Right? It's not going to teach you all of the answers to all of the misleading claims and myths out there. What it's going to do is give you a structure and a framework to have these conversations and feel confident in these conversations that you are understanding and exploring the parents' concerns or the patient's concerns, and then helping them to find their own motivation for vaccinating.
Thank you for that plug. Appreciate it. And yeah, we love, reminding folks that it doesn't have to be scary or combative. It can just be a conversation. One last question. Can you share with us kind of your elevator pitch for why the move to shared clinical decision making is not necessarily a good thing? Because on its face, it sounds like it could potentially be a good thing to, your average person.
Yeah. So my elevator pitch changes depending on who I'm in the elevator with. And this is really important. So if I'm talking to policymakers, and today I'm talking to you, and I am assuming, sure, there are probably people on this call that on this webinar that are parents and are making some of these decisions, but also a lot of you are clinicians or leaders in your community. And I'm going to explain a little bit more nuance. But if I'm in the elevator with a parent, with the general public who sees shared clinical decision making as that sounds like a great thing, this is my elevator pitch. I say, hey, we as pediatricians have always shared the risks and benefits of vaccines, left an opportunity for questions, and have respected your autonomy for choosing what's best for your child. Nothing about that has changed. We have always shared in the decision-making process, and we're going to continue to do that, just like we always have. That's my elevator pitch. And I really don't think that parents in the community need to, I don't think you need to go into more about the nuance about shared clinical decision making as a policy designation and how it is sometimes used in other areas of medicine, because that's not how the public is interpreting shared clinical decision making, right? So my elevator pitch is we've always been doing this. We're going to continue to do this just like we always have.
Perfect. That's a great, simple, concise answer again, and very useful information. So thank you so much, Dr. Higgins, for being here today and for doing this for us. Um, Folks who are still hanging around, you'll see a QR code on the screen for our post-webinar survey. These are really helpful for us to just get a better understanding of what information you all are needing on your day-to-day, and to make sure that the events that we put out for you all are useful, important, and valuable for you. Big thanks again, Dr. Higgins. Really appreciate you. Thanks everyone for
Thank you.
attending. As a reminder, this was recorded. All the resources will be shared and on our website within a week. So thanks everyone.